I'm in lymphoma, so I'm most interested in the new things that are happening there. There were quite a few. You can cover that under the heading Immuno-oncology. That's really the new approach through which we try to give benefit to patients with both Hodgkin's lymphoma and non-Hodgkin's lymphoma. And the attractiveness of that approach is that it's quite specific for the interaction between the malignant cells and the defense mechanisms that are in the body of the patient. So what we have learned is that the malignant cells suppress the reactivity of surrounding cells that might kill them. They suppress them by specific bindings. If you block those bindings between the malignant cell and the lymphocyte, the cell that is able to kill the tumor cell, if you block that binding, then the lymphocyte, the immune cell, will get activated and attack the cancer cell and kill it. And that's what we call treatment with immune checkpoint inhibitors, antibodies that can do the job. And we have seen exciting data both in Hodgkin's lymphoma but also in a variety of non-Hodgkin's lymphoma. Quite easygoing, rather non-toxic approaches that yield terrific results in terms of complete remissions. The disease is completely disappearing, the PET scan becomes negative with long duration. And even if a patient relapses after he has stopped that treatment, you can retreat again and again remissions. So that is one of the things that was for me one of the highlights of this ASH meeting in where are we? In Orlando in Florida. Together with another immune attack on malignant cells done by what we call Brentuximab vedotin, an anti-CD30 antibody to which a cytostatic drug is linked. And that's also very effective in searching in the body the cells that express CD30 on their surface. It hooks to that, and the whole complex is internalized like a Trojan horse, and the cytostatic drug that is on the antibody gets loose and kills the cell immediately. So it's a Trojan horse that is coming inside. And also those data, also in combination with cytostatic agents now, that's the next step. Last year we heard about the single agent data of Brentuximab vedotin. Now there are combinations being presented that are even more effective with tolerable side effects. And also combining the Brentuximab vedotin antibody-drug conjugate with the immune checkpoint inhibitors is now coming up. So we are entering a completely new era with, expectations for patients that are now realistic.